Welcome to our second seminar supporting our health track for T9 Hacks, which is happening March 19th to the 21st. We have the amazing Aubrey Schick today. Aubrey is a product designer and researcher. She is specializing in socially assistive agents, wearable computing, and medical devices. I will now invite Aubrey to start her presentation.
So I noticed that you guys had me in the health track, and that's good. That's actually good for me. I kind of approach health from kind of two different avenues. One is kind of socially assistive technology, which includes robots and agents, and kind of like social and emotional related health type stuff, health and wellness. And then the other side that I've worked on is wearable devices. And so for the hackathon, Dan suggested that I focus a bit on my wearable side. So I can jump into that. So I'm going to talk about wearable device design and particularly lean into the health side of that. Wearable devices can have a lot of different use cases and opportunities. But since we're in the health track, we'll be talking about the health side of it today. So everything here are actually wearables that I have designed myself and built. And let me try to advance my slide. So I like to start out with like, what is a robot when I talk about wearable devices? And everybody has a very different sense of what a robot is, and people have different senses of what wearables are. And so, in my humble opinion, a robot is an intelligent system that can sense changes in the environment and respond by functionally changing state and communicating information to humans, right? And so, in my case, a thermostat is, I would consider a robot. Um, so, to me, a wearable device is really a robot that is worn by you, your bike, your dog, whatever. And and it's something that senses, responds, interacts, displays, and learns. And I think that's a really important perspective, particularly when you're thinking about it from a career and a hacking and a solutions point of view, because anybody who's really great in robotics is going to be really great in wearables, or anyone in wearables can have devices, careers, innovations in robotics, right? So it's just a important way to think about things. And with that, I want to talk a little bit about just who I am and what kind of gives me the authority to talk on these things. I do a lot of things. I've done everything from medical devices to being executive staff at a robotics company. I am a research affiliate in the Atlas Institute right now. I started out at Carnegie Mellon University in the Quality of Life Technology Center, Human Computer Interaction Institute. And before that, I was also an industrial designer and actually also minored in mechanical engineering. But along my path, I also spent some time at Intel, where I worked on a lot of different wearable devices. And I'm actually about to start a new role at the FDA in the Division of Digital Health. So a lot of people know that the FDA regulates medications and devices and things like that. It turns out they have a digital health group as well that regulates software, wearables, and things like that. And I'm about to join their group. So why do we make wearable devices? And health here is at the top of the list. And my boss at Intel used to say, to give people superhuman powers, right? To give us the ability to do things that we couldn't do without them, right? And so health, wellness, convenience, safety, information, style, all of these things. And there's some wearable devices that you've probably heard of, things like Google Glass, things like Apple Watch, Fitbit, those sorts of things. But there are also a lot of other wearable devices that are really, really important and have significant health implications. So just kind of looking at this screen here, we've got pain management wearables. We've got wearables that actually allow you to use muscle actuation in your forearm to actually operate and interact with things, which is particularly important for anybody who has missing fingers, things like that, or lack of ability there. The one in the lower is for people with incontinence who have trouble understanding when they need to go to the bathroom, sleep tracking. Uh, some folks are familiar with continuous glucose monitoring, which is really, really life changing for people with diabetes. In the upper right corner is to prevent against sudden infant death syndrome. I mean, there are all sorts of applications for wearables. So, when we think about why to design wearables, one thing you think about is that there's an interest in them, and it's something that people want. Some of the quantified self, personal informatics, people we're seeing now that people are actually really motivated by having this information. And people are beginning to understand how wearables can improve their lives. And part of that is because of user experience and interaction design, by actually communicating that information to them in a way that's easy to understand, they're actually able to act on them, right? So getting them to a point where they're simpler and not as clunky as they used to be. I mean, back when I was in grad school, we were creating wearables to increase people's physical activity, right? So the idea was that we would display information so that people would be more active. But at that point in time, we didn't have accelerometers like as at least the data is readily available at our phones and things like that. So we actually had people wearing pedometers along with the device we had built to be able to take the data and respond. So it was, things have changed a whole lot within the last, 10, 15 years. And we're in a totally different place. Things are smaller, more reliable, batteries are totally different, and connectivity is totally different. So there's a lot of opportunities. And I know that we're kind of thinking about things from a design thinking perspective here as well as health. And so I wanted to kind of throw this picture in from a workshop series that I've done, where I've done a brainstorming session with both high school students and first graders. And I only had my photos from my first graders, where what we would do is we would think of a user. They could think of any user they wanted and think of their needs. What is their problem? With the high school students, for example, they thought of like their grandmother who couldn't see the display on their watch. And so they could make something with like a really big display and with like a really big microphone, a really big speaker and things like that, and really think of that need and that use case, and to be able to detect if they fall and things like that. And then what we did is, I gave the kids felt and glue and LEDs with watch batteries, and we actually had conductive thread, right? So it was really, really easy to get to something that you could wear and talk about, like how you would use it and what you would do with it, and then stand up in front of the room and discuss. So it was, a really quick, fun project that, people weren't blocked by their technical skills, and just having that kind of LED that would blink, they could be like, oh yeah, and when it would turn blue, it would mean this, or things like that. So it's just a really nice way to get everybody doing things. So I wanted to talk quickly about some different wearables that I've actually designed and built. I talked about the one on the shoe already, and the fact that we actually had to have real big, pedometers the size of pagers when we were doing this, because we didn't have the teeny tiny little accelerometers that we have now. The one in the upper right was actually a full wearable computer, and it's amazing to think of this now that we've got Google Glass and so many other things right now. But this was a system that was developed for caregivers who were taking care of dementia patients. And there was actually a set of glasses that connected to this vest, and the vest had all of the processing and the battery and everything for the caregiver to be able to wear the glasses and get information. This was part of a NIH project that I did at Carnegie Mellon. Now, again, from a user experience perspective, we were researching how caregivers are taking care of their loved ones, but there are really important things like somebody's being recorded and we need people to know. So in that upper right corner, it's dark there in this particular case, but it would have a big inch square red light that would let you know when it was recording. And if you were helping somebody in the bathroom or something, you could press on that and it would go off for 10 minutes. And before it would start recording again, it would flash, right? But how do we know that somebody is going to be able to see that flashing in time? How do we know how quickly someone can react to that? How long does that flashing period need to be? And for that information, we actually did another study in the middle, and this is published work in the center, where we built this array of little button-sized sensors that we would put all over people's body. We'd put them on the brooch and the shoulder and on your foot and hip and all of the places where you usually have wearable devices now. And we had the lights randomly go off, and then there's a button on there. And so we knew how long it took somebody to react to a light going off in those areas. So we would know how long you would need to provide that information for someone to be able to reasonably see it. Another really important thing in both that vest there and the vest that you'll see on the left, which I'll talk a little further about that in a second, is the pockets, right? So when somebody's wearing this wearable computer, and garment-based wearable computers has been one of my favorite soft spots that I've done. You've got to not only think about how this can be washed and such, and don't let anybody tell you that wearable devices can't be washed, because I've designed several to be washed. But you also have to think about, okay, now you've obscured their pockets. Where are they going to put their keys? Where are they going to put their phone? And the only way that they're going to be compliant and wear your device correctly is if you give them affordances for that. So that's something you really have to think about. The one on the left here is, I'm going to get into it a little bit deeper later in the presentation. This one is to provide a musical experience for the deaf and the hearing impaired. And so what this allows you to do is to plug in your MP3s, or MP3s at the time, plug in your phone or whatever music you have, and it would break down over 32 individually addressed motors on the body, so that you could feel the music and actually tell the music apart. Now, for demo purposes, we actually had LEDs on the opposite side of the motors, so that you could watch the music move over the person's body as well. And so that was a pretty fun project to work on. I've also, at Intel, I worked on a lot of head-mounted displays. A lot of this was not for health. A lot of this was for logistics, so people doing field maintenance and things like that. And the technology had originally been built out into ski goggles for people on the slopes to know where they are and how fast they're going and where their friends are. But we had pushed it, we were pushing it to be used for maintenance, manufacturing, and other logistics use cases. So everything a lot of the things I did at Intel were head-mounted displays, right? So providing this information to people. And there are many, many types of head-mounted displays. And a really important thing now is that they're now getting light enough that they're much more comfortable, because head-mounted displays can cause a lot of neck pain and frustration. And a lot of the time when they're doing the weight and the human factors of it, they're thinking of men. And what we actually found out designing for logistics and manufacturing is that actually a really high percentage in precision manufacturing is women anyways, right? Which the designers and developers don't always think of, but when you're a researcher and you go out into the field and you see who is actually there on the assembly line, it's really important to bring that back to the developers. So, I think I've already talked about this a little bit, but thinking about how wearables are similar to robots, it's really in every way. And this picture kind of dramatizes a bit, but, everything from your thermal considerations to your battery life, to your durability, whether you have actuators or haptics, which is, vibration, basically everything's the same. And that's just a really important thing for people to think about. And I wanted to talk just a little bit about some of the lessons that I learned, and then give you guys some time for questions. And you can also ask, if you want to ask specific health related things, you can do that too. So I talked a little bit about the Firefly display already. So this was actually a research project where we wanted to understand how long does it take to see this information on different parts of the body. And the publication is below there. It's called Where to Locate Wearable Displays. Um, and it was just really simple, just LEDs, coin cell battery, proto boards, and a safety pin. And I will say one thing that I did that was it seems like not much of an innovation, but was really important, is putting stickers on all of them. So I knew what part of the body they were, because we would then take them and you had to manually take all of the data off of them with like a little bootloader thing. So it was really important. And I also had different sets of them for all of the participants. So each array of sensors was color coded. It was really important to do that. I can't say it enough. And also when you're doing prototypes of different wearable devices and things, it helps to, if you have a bunch of batteries that you're charging in a bank, color code all of those and use them together, because you don't want to mix the batteries because you'll get weird performance. It's just something that you learn in prototyping. Pediluma is one that I was talking about. So this whole project was all about the public display of personal information, and how can, wearing a device that displays your physical activity and your impact on the environment, you know, making that available to other people in your environment, how does that affect what you do? And, it was pretty simple to build this, but we ran into a lot of interesting things in terms of like, for example, one of our participants felt really, really uncomfortable in a parking garage. It was a woman in a parking garage at night. So she had been walking a lot and it was all lit up and she was like concerned. So what we learned is that you really need to have control over when this information displays. It can't be a passive thing. Sometimes it was nice. It was this like talking point, like, oh, what is, what is this device and what does it mean? And that was kind of fun. They found it, great for talking to kids and things, but sometimes they didn't want to talk about it, So I showed this earlier. So this is actually a wearable device, and it actually tracks like um, my sleep and steps and things like that, and it's waterproof and all those other things. But I have control over when this displays, and I also have control over when I see the information on my phone. So it's really important that people are influenced by being able to see their information, but they also need to have control over it. And you also need to have a level of abstraction, so that, for example, if I haven't walked very much lately or been very active like today, I can't even like display anything for you. That people have control over whether they're embarrassed or not. Um, this one here, first person vision, I talked about it a lot. So this had to be washable. It had to be wearable by someone 95 to 250 pounds, right? So imagine designing a garment with that kind of range. And we did it. We actually, and then we manufactured them in a small volume too. Like we had like 6 of them made, which is, and they would wash them and press them and give them to new users between them, and they would wear them for 8 hours a day. And so what we did is on the side there, we used like a sport fabric, like a gusseted sport fabric, and we used shock cord, which is similar to what you see on backpacks and sporting equipment, and that would kind of cinch it in and make it fit, form fit. And then we had what's called an invisible zippers in the back, where we could kind of put the access in. So the device would kind of take the shape of the user, and then they could take it off and on throughout the study and it would stay fit to them. So that was interesting. There was the LED recording I talked about. It had to have this huge battery life. There was a lot of thermal concerns because the processor would get hot because of all the video going on, because we were actually taking video of the person's pupil and the world and then correlating that in real time to know exactly what they were looking at. So this is back before a lot of the lighter weight processing that we have now. And it was a really interesting project to work on. And the data was then reviewed with nurses, so the nurses who were helping these people taking care of their elderly loved ones, to help coach them on what they can do to kind of better support that process. And then VibeAttire, so this is one that I've got the best pictures of. So again, this was to give, it was originally a project that was designed to allow hearing impaired people to compose music. And over time, as we built it, we found that, actually hearing abled people really enjoyed it, as well as a richer experience of their music. um, it was really important to be able to differentiate between songs and really feel them, because just kind of vibrating to the music, that doesn't really give you the experience. So it was really interesting to kind of create a way to break down music effectively, like into MIDI bands, and map that to the body. It needed to work with like a 3.5 millimeter jack, which our phones don't even have anymore. So you can see how dated this is. um, the LEDs were to be able to demo it, to be able to communicate to people what is happening, what is this experience. Because it needs to be not only the person who's wearing it, at least when you're in an early stage of your technology, but also other people around to really understand the experience. And rechargeable, obviously, but the washable element, if somebody's dancing or moving around and wearing this, and a few of these were built. So there's one in Toronto, one in London, and I actually have the other one here in Colorado. Um, it has a membrane inside of it with the electronics that actually removes so that the other part can be washed. Kind of like a duvet cover, if you're familiar with like the feather tick quilts, that you can take that out. So that's how we handled that. And the whole process, how do you think about where you locate those motors? Because if you put them on the bone or the wrong part of the body, it can not only not communicate that information, that vibration, but it can be very uncomfortable or painful. So we did a lot of testing. We mocked up different configurations. We didn't jump immediately to a vest, right? So we thought about, can we use sleeves? Um, can we use like a neck wrap type thing? And over the years, you've seen some of these different form factors have happened. There are other products like that. We created a looks like prototype using like little acrylic disc to kind of communicate what it would be like, what it would feel like, and then eventually built the thing. But when we finally built it, we learned a lot about the need for mixing fabrics, both rigid and stretchy fabric, using snaps versus like Velcro or things like that. We wound up using shock cord. We wound up using different drawstring and LED type things. And also the very weave of the fabric was really important um, to be able to show the LEDs through. And we did a lot of strategic use of buttonholes, right? Because when you think about a buttonhole, you usually think of putting a button like to close your shirt, right? You don't think about putting knobs and controls through it, as you can see that we did here, right? We also used invisible zippers. So here, I don't know if you can see my cursor, but this is actually where you open up the membrane to remove the electronic element. But we also made sure that it was like kind of a stylish design element at the same time. And then again, the same thing that I talked about with the elderly group. We wanted this to be able to fit a wide range of people. So you can kind of see all the details that we went through there. We had to kind of dampen the vibration motors, because they would kind of buzz a lot too. There were just a whole bunch of things that we needed to do. But given the amount of time that we have, I think I've talked a lot about, being able to demonstrate the intent, communicate the meaning, engage the audience, and wow the viewers. Like that's, the LEDs were not part of the original concept of the design. But as we all know, the only way you get attention is if you're really able to communicate what you're doing. And so we did create the ability to shut off those LEDs for somebody. So if they wanted to have that private experience, they could. And I'm not going to have you guys watch the demo. So I do have it here. And if we were doing this in person, I could definitely let you guys try it out. But with that, I'm going to stop sharing and give you guys at least a couple minutes to ask me questions.
I have a question. I know you were talking about like how you guys kind of faced some unexpected problems in terms of like head mounted wear when it was like made for like men instead of women, and then like you were talking about like the LED experience being like private for some, and like having that control. Kind of like what kind of maybe unexpected or really surprising challenges or problems did you guys kind of come across that you didn't even like think of at all? And then it just kind of like after you got some feedback, you were like, oh, you know.
Um, I mean, there have been a lot of things. Really a ton of things. One very interesting one, when I was at Intel, we were designing these glasses for people in the workplace, and we went to one of our field testing locations, which happened to be in Arizona, where a lot of the employees were actually Native Americans, and the width of their cheekbones was hitting into the glasses in a way that was making them fog up so much that they couldn't use them, which is something that, even looking within the different human factors standards and designing for all of that, that we hadn't considered at all. So that was really interesting. However, it was a high percentage of the workforce in that location. Another really interesting thing is, the record light. You would think some employers, they don't want the record light to be on because they don't want the employees to change what they're doing or anything like that. But actually, when we interviewed some of the employees, they were like, "No, I want that on all the time, so nobody talks to me, nobody bothers me, no one will come around me." So that was pretty interesting. Um, in terms of, I think I'll make a comment on health related things too. I know that, I know a woman who was using some of the continuous glucose monitoring stuff, where her phone would notify her when she had spikes and things. She found out that one particular pizza place, so it wasn't every time she ate pizza that she had a glucose, that she had a spike. It was when she went to this one particular place, and she just learned to deal with that. And how else would you ever know without that kind of tool? You'd just be pricking your finger all the time. Working in wearable devices and robotics for definitely well over 10 years. And I would have never, ever, ever imagined thinking about taking a role or working at the Food and Drug Administration. But this is a new world. And, technology is providing this opportunity to really influence personal and public health in a way like never before. And, uh, you guys know what kind of background I have with human computer interaction, industrial design, and a lot of skills very similar to what you all have. And so I encourage you to, not leave that out in terms of roles that you might consider in your future.